Mary joins us now to talk more about the health sector in 2020. Good evening, Mary.
Good evening.
Now, you've reported on the health sector for many years, but I'm sure that the year 2020 stood out and was probably the busiest for you due to the COVID-19 pandemic. But how would you characterize the sector in 2020?
What a year, BC. Let me start with the fact that we already knew we never had enough doctors, nurses, and health workers in the country because of the brain drain. Doctors just leaving our shores every year. The register, NMA register, has 75,000 doctors, but they report that 33,000 of those doctors have left. So we have about 42,000 manning 200 million people in the country. Just 42,000 doctors. Then what happens when COVID comes? We start to lose our doctors, we start to lose our nurses and our health radiographers, because people with COVID-19, they take chest x-rays as well. The Nurses Council reported that more than 3,500 nurses were exposed, and out of that, they've lost 13. 260 have tested positive. As at the end, towards the end of September this year, 16 doctors were dead. And just a few days ago, they were reporting 20 within a week. So there's a lot going on in the health sector. It was weak, but it's getting weaker. When COVID landed on the scene, it was as if it drew all the doctors, all the resources towards COVID. So Lassa fever was left. At a time, we're asking, do we still have Lassa fever? And lo and behold, people were still dying of Lassa fever right up till this month. But not enough hands. Then the problem of not having PPE, and then the problem of doctors, resident doctors, going on strike within the COVID-19 pandemic. And that included doctors who were taking care of COVID-19 patients. That was a real crisis situation. It hasn't stopped being a crisis situation. Let me talk about missed vaccines. People were afraid to go to the hospital, but those who even ventured out were told, a lot of them were told, we can't attend to you. COVID-19 is on the scene. Let's reschedule your visit. Lots of people missed their vaccines. So there are lots of children, just trying to make up for the vaccines they lost during the period of the lockdown. Even now, people are scared. I paid a visit to an isolation center, and you wouldn't want to see what's going on. Because right now, there's home-based care, at least in Lagos. So all the cases admitted in the isolation centers are critical cases, moderate, severe, critical, and they're using oxygen. Nurses have to sit by their side all the time. They just change the shifts. You cannot leave your patient alone. And this in a country where other diseases are going on and you can't handle them. That's just infectious diseases. Let's talk about non-communicable diseases. People get hypertensive and they come and they're not attended to. So I've heard of so many heart attacks in the last few weeks, and people going into coma from diabetes, diabetes shock, cardiac arrest, all sorts of things. We just don't have the capacity to handle COVID in the states that we are now and handle other diseases. Give or take, test samples have been about the same for every week. 42,000 tests, 35,000 tests, 50,000 tests. But the infections keep going up, which means just imagine if we had more tests done. So it wouldn't surprise me to find out that we're having much more cases than are being reported, minus the asymptomatic. Some people get these symptoms and just say, well, I'll just tough it out. And it's spreading. Now we are in the second wave, which means more infections, more deaths, the cases are more serious, but other diseases aren't waiting by for COVID to finish its thing, before coming back. So it's really bad. Then there's the mental health aspect, where depression has set in for some people. In fact, a doctor was telling me that there's this thing about death and mental illness in people who are not COVID positive. They are just the relatives or handlers of those who have COVID. So the fear that they've caught COVID has sent them to an early death without having COVID.
That's a serious issue.
It's really bad. We have some things called psychosomatic diseases, diseases that come on people by reason of mental trauma. It's like having post-traumatic stress disorder because your relative is sick with COVID.
Right.
So the patient has COVID and you are getting ill because your relative has COVID.
All right, Mary.
There's so much going on.
I know there's really a lot going on, just as you mentioned. But what's most important is we all try to adhere to the guidelines and try to stay safe as much as we can. Thank you, Mary.
You're welcome.